Ever been stuck in a mirror battle with a stubborn zit that just won't quit? Well, you're not alone. Cystic acne is a common skin issue that many individuals grapple with. Unlike your run-of-the-mill pimple, cystic acne is a more severe form of breakout, characterized by deep inflamed blemishes that can be quite painful. Now, why does cystic acne happen, you might ask? It's all about the pores. When a pore gets blocked by excess oil and dead skin cells, it can become inflamed, causing a cystic acne breakout. In today's video, we're going to delve deep into the world of cystic acne extraction. We'll explore why it's different from popping a regular pimple, what it involves, and why it's best left to professionals. This isn't your everyday skincare routine, folks. It's a journey into understanding and dealing with one of the most stubborn skin issues out there. So if you've ever wondered how to handle these stubborn blemishes, you're in the right place. So you're probably wondering, what does the extraction process entail? Well, in the context of cystic acne, extraction is a dermatological procedure that involves removing the accumulated sebum, dead skin cells, and bacteria that cause these deeply embedded skin blemishes. It's a method that helps alleviate the pressure and pain caused by the buildup beneath the skin and can aid in reducing the risk of scarring and further skin damage. Now, let's be clear, this isn't something you should be doing at home in front of your bathroom mirror. The extraction process is typically performed by trained professionals like dermatologists or skincare experts. And there's a good reason for that. Cystic acne is located deep within the skin, and improper handling can lead to severe skin damage, scarring, and even infection. The extraction process is carried out in a sterile environment. Think of it as a tiny, microscopic surgery for your skin. The professionals use sterilized tools and follow strict hygiene measures to ensure the area remains uncontaminated. It's crucial to prevent any bacteria from spreading during the procedure, as this could cause more harm than good. So, why extraction? Well, cystic acne is different from your run-of-the-mill pimples or blackheads. They're more stubborn, more painful, and if left untreated, they can cause significant scarring. Extraction helps to speed up the healing process by removing the root cause of the problem, the pus-filled cyst. It's a direct approach to tackle the issue head-on. But remember, extraction is not a one-size-fits-all solution. It's just one part of a comprehensive acne treatment plan. It's often combined with other treatments like topical creams, oral medication, or even light therapy, depending on the severity of the acne. Now that you have a basic understanding of what extraction is, let's delve deeper into the step-by-step process. Ready to uncover the steps behind the extraction process? Well, let's dive right in. The process of extracting cystic acne isn't as simple as popping a pimple. It requires meticulous care and precision. The process can be broken down into 3 key steps: preparing the skin, the extraction itself, and the aftercare. Each step is crucial in ensuring a successful extraction and preventing complications. The first step is all about preparing the skin. This is a critical stage that sets the foundation for the extraction process. The skin needs to be clean and soft to allow for a smooth extraction. This is achieved by washing the face with a gentle cleanser followed by a warm compress. The warm compress helps to open up the pores and soften the skin, making it easier for the cystic acne to be extracted. Once the skin is prepared, we move on to the second step, the extraction. This is where the magic happens. But remember, it's not a magic trick you want to try without professional guidance, as it involves a sterile needle and precision. The cystic acne is gently pierced with the needle, allowing the trapped sebum, dead skin cells, and bacteria to be released. This part of the process should be done with utmost care to prevent scarring or further infection. After the extraction, it's time for the third step, post-extraction care. This is an often overlooked but essential part of the process. Post-extraction care involves applying a soothing antiseptic cream to the extracted area to prevent infection and promote healing. It's also important to avoid touching the area with dirty hands and to keep it clean and dry. Now, let's recap. First, we prepare the skin by cleaning it and applying a warm compress. This opens up the pores and softens the skin. Second, we carry out the extraction with a sterile needle, releasing the trapped material inside the cystic acne. Lastly, we take care of the extracted area by applying a soothing cream and keeping it clean. It's important to remember that this process should be carried out by a trained professional. If performed incorrectly, it can lead to scarring, further infection, and even more severe skin conditions. So while it's crucial to understand the process, it's equally important to leave it to the professionals. This step-by-step process might seem a bit daunting, but when done correctly, it can help effectively manage and treat cystic acne. The key is to be gentle, patient, and diligent in each step. And there you have it, the step-by-step process of cystic acne extraction. Before you rush off to try this at home, there are some important do's and don'ts you need to know. First off, the do's. Always start by cleaning your hands and face thoroughly. You don't want to introduce any extra dirt or bacteria into the mix. Next, do use a warm compress on the area for about 10 minutes. This helps to loosen up the skin and bring the cyst closer to the surface. Now, if you've got a proper extraction tool, do use it. These tools are designed to apply even pressure around the pimple, reducing the risk of scarring. If you don't have an extraction tool, use 2 clean cotton swabs instead. Do apply gentle, even pressure. If the cyst doesn't come out easily, don't force it. It's not ready. Trying to force it could lead to scarring or a deeper infection. After extraction, do apply an antibiotic ointment and a bandage to protect the area. Now let's talk about the don'ts. Don't ever use your fingernails for extraction. This can cause damage to the skin and increase the risk of infection. Don't go in without a plan. If you can't see the white or black head of the pimple, it's best to leave it alone. Don't forget about aftercare. Don't pick at the area or try to extract more after you've finished. This can lead to inflammation and scarring. Don't skip the antibiotic ointment. This step is crucial to prevent infection. Lastly, don't attempt to extract deep cysts at home. These are best left to professionals. Trying to extract them yourself can lead to serious complications like infection or scarring. These do's and don'ts are not just tips, they're essential guidelines to remember when dealing with cystic acne extraction. While extraction can be an effective method to manage cystic acne, it needs to be done responsibly and with the right knowledge to avoid causing more harm than good. Remember, knowledge is power, especially when it comes to taking care of your skin. We've covered a lot today, so how about a quick recap? We embarked on a journey to understand cystic acne, a skin condition characterized by deep, painful blemishes. These aren't your everyday pimples. They're rooted far beneath the skin's surface and can cause significant discomfort and scarring. We then delved into the extraction process, a delicate procedure that requires precision and care. It begins with cleaning the skin, followed by the application of a warm compress to soften the skin and open up the pores. Next, a sterile needle is used to create a small opening in the blemish, allowing for the extraction of the pus and debris. Sounds a bit gruesome, doesn't it? But when done correctly, it can provide immense relief and accelerate the healing process. And let's not forget about the do's and don'ts of extraction. As we've seen, it's crucial to ensure the skin is clean and the tools are sterilized before starting. Patience is key. Don't force the extraction. If the blemish doesn't give, it's not ready. It's also important to apply a soothing antiseptic cream afterward to prevent infection and promote healing. However, the most important takeaway is this. Extraction is not a DIY endeavor. It's a procedure best left to the professionals. If you're dealing with cystic acne, seek help from a dermatologist. They have the knowledge and tools to perform the extraction safely and effectively, minimizing the risk of scarring and infection. Remember, taking care of your skin is not just about looking good, it's about feeling good too. It's about confidence, self-esteem, and overall well-being. So, don't let cystic acne get you down. Seek help, follow professional advice, and never underestimate the power of proper skincare. And that wraps up our deep dive into the world of cystic acne extraction. Here's to clear skin and confident days.